Hello, and welcome to yet another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, September 25th, 2024, and I'm Franco Samataro. I'm the Program Coordinator for Shaman Senior Voices, and I'll be your moderator for today's lecture, Medicare 101. Before I present to you the wonderful panel of speakers joining us today, I'd like to first thank Hannah Weinsman for helping with the production of this lecture, helping us manage the chat and other key aspects so that we all have a great discussion about Medicare 101 during our observance of Prevention Week. As always, we're live streaming this lecture via our YouTube channel using the video platform Zoom, which also allows us to host a good number of you to join us via phone. Thank you so much for joining us. And for those on YouTube, we ask that you please use the chat function to ask questions and/or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to the presenters. And for those of you listening to the discussion via phone, you also have the opportunity at the end to unmute your audio so that you can ask your questions. I'll remind you of that during that time. We'd like to remind you that all information offered here is for general information purposes only, and to always seek additional professional advice for situations specific to you and your needs. And without further ado, I'm going to do our introductions. Stephanie Bailey is a licensed clinical social worker with over 20 years of experience working with older adults. She has worked for many healthcare organizations and nonprofit agencies, and she has worked as an outpatient social worker at Rush since 2013. She is a program coordinator for caring for caregivers at Rush. She is also certified senior health insurance program counselor, offering free unbiased information related to Medicare options. Our next presenter, Sonia Serrano, is a licensed clinical social worker with 10 years of experience working with older adults. She comes with experience of working in nonprofit agencies, nursing rehabilitation facilities, and primary care providers. She is a clinician for caring for caregivers at Rush. She's also a certified senior health insurance program counselor and is always looking forward to collaborating with the community to help educate and inform clients. And our last presenter for today will be Janine Cockrell, who has been practicing as a physical therapist at Rush for nearly 23 years. She has experience in acute care, outpatient, and home health settings, with most of her experience in acute care. Welcome all, and thank you. Without further ado, I'd like to present Stephanie and Sonia to kick us off.
Hello, everyone. I'm Stephanie. I'm going to share my slides here. One moment. I hope you all are seeing that. Okay, good. Thank you, Franco. Hi, so as Franco said, Sonia and I are both SHIP counselors in the state of Illinois, and that's the Senior Health Insurance Program. And we're happy to be with you today. We know that this presentation always brings up questions for people, and we certainly do invite you to ask those in the way that that has been presented to you. And please just be aware that it's most helpful if your question is something that can benefit others as well. If you do have a really specific question, just be reassured that we're going to give you information about how to contact SHIP counselors near you. Today, we hope to give you a broad overview of your options with Medicare and to help you understand the different ways to access those benefits and to help you learn ways of making this essential care more affordable. We'll also briefly go over some important changes which are coming next year. We'll briefly talk about what is Medicare and who's eligible. We won't spend too much time because we are aware that most people on this call probably have it already, but I'll briefly touch on these. So briefly, to be eligible for Medicare, you need to be a US citizen or legal resident, 65 years or older, or under 65 and have been receiving Social Security disability for at least 24 months. Some individuals under 65 with certain conditions can be placed on Medicare more quickly. So there are certain qualifying health conditions that will qualify you sooner than the 24 months. There is some great information online at medicare.gov, which we will mention many times as a place to double check a lot of this information. But they have information there about the special conditions that can qualify you sooner if you're under age 65 and have been diagnosed with a disability. For those age 65 and over, it's generally folks need to have 40 plus credits of Social Security covered employment. So that means that your employer is paying into Social Security, or it'll say FICA. So that is about 10 years full-time work. And eligible for Social Security, if you have those 10 years of full-time work, that would mean you're eligible for Social Security and premium-free Part A. You would still pay a monthly premium for Part B. Others may purchase Medicare, so those who are age 65 and have done some work, but not enough to qualify for premium-free Part A, are able to purchase coverage if you have fewer than 40 work credits. So the amounts are there. If you have sort of 29 credits or less, it's $505 per month for Part A. And if you have 30 to 39, it's $278 per month. Those are for this year. We don't have the amounts next year. And it does sound like a lot, and there are ways to make Medicare more affordable in general. But again, just keep in mind that most people are going to qualify for premium-free Part A, so they're not paying a monthly premium for that portion of Medicare. And now I'm going to pass it to Sonia for the next bit.
Thank you, Stephanie. Hi, everyone. My name is Sonia Serrano, and we're going to continue discussing Medicare and the different parts of Medicare and ways to access Medicare coverage. So Medicare has 4 parts: Parts A, B, C, and Part D. You can go ahead with the next slide. So Part A, it's the hospital insurance, which covers hospital, skilled nursing facilities, home health, hospice. And then we have Part B, which covers medical outpatient appointments, so such as doctor's services, tests, vaccines, labs, ambulance in case of emergency situations. And then lastly, Part D. D is in drugs, so think of drug. D covers prescription medication. Next slide, please. There's also the Medicare supplement, which is also known as Medigap. So some, you'll see that some Medicare parts also have another name. So we'll make sure we name that so you're aware. So for these, for the parts of supplement, it's a health insurance sold by private companies to supplement Medicare. So it's used with original Medicare, and it only pays if Medicare pays. And you must have a Part A and a Part B. And then we have the Medicare Advantage or Medicare Replacement, which is a Part C. And we will go into a little detail. And just note that this is not really a part of Medicare, but instead it is a different way of obtaining your Medicare benefits offered by private companies. And it combines benefits offered by original Medicare, and most of these plans also offer prescription coverage. Next slide. So here is more of a visual representation. So you can either go with the left side, which is you can see original Medicare. It's the Part A, Part B, the Medicare, the supplement. And then there's the Part D, the prescription drug. And then on the right side, you see the Medicare Advantage plans. which is like the Part C. It's also known, it includes the Part A and B, and most often the Part G is included in those plans. Next slide, please. And here's a little, another more detailed way to look at the same information. And we'll talk about enrollment periods. But first we'll be focused on getting started with Medicare and then go into more details. We will first cover original Medicare A and B, adding in Part D, and an optional Medicare coverage. Next slide, please. So for the enrollment periods for Medicare Part A and B enrollment periods, the initial enrollment period, also called the 313 rule. So you can enroll 3 months before the month you turn 65, the month you turn 65, and 3 months after you turn 65. And this rule also applies to individuals who are receiving their 25th month of disability. All right, next slide, please. Other times you can enroll, there's a special enrollment period. You may be able to delay enrollment if you or your spouse are still working and covered by an employer group or a health plan. And you can always check with your employer and confirm with Social Security if delaying the Part D. And there's also the general enrollment period. So if you don't enroll when first eligible or you miss your special enrollment period, this general enrollment period is January 1st through March 31st of each year. And then the Part B, once you enroll, it starts the month after that enrolling. And now I'm passing it on to Stephanie.
Okay, thank you, Sonia. And to remind you, these are the kind of two different pathways of obtaining your Medicare. And so to remind you, we're now going to kind of look at that left side in a little more detail. So the original Medicare method. So original Medicare, of course, is what most people call their red, white, and blue card. It is a pay per service system. You would get your Medicare summary notices in the mail. You can go to almost any doctor anywhere in the US. There are limits to what you can be charged, and it covers most medical needs. This is just an example of what the card looks like. I think most of you all know this by now, but they have removed the Social Security number from people's cards, which was a very good move because most folks do tend to carry this card with them. And we were seeing that people were carrying their Social Security numbers, which obviously can lead to a lot of problems if they lose it or their wallet is stolen. You can still provide your Social Security number if you don't have this card handy, you can provide that and Medicare can look you up that way. Since most people have that in their knowledge, in their minds. So what does Part A cover? It covers hospital care, skilled nursing facility, hospice, and home health. So generally it includes the care that you get in these type of facilities or at home with hospice or home health. In general, it provides ambulance transportation in very specific circumstances when other transportation would endanger someone's health, always to the nearest facility. And there are several things that aren't covered during the hospital stay, private duty nursing, private room, although we're seeing that most places offer that, thank goodness. Things like personal care items, razors, slipper socks, and things like that may not be covered. In general, these things are covered under Part A though. And these are your Part A costs for this year. Again, we don't have next year's amounts yet. They have not released them yet, but Medicare.gov is the best place to find those. We always keep an eye on that. Monthly, again, most do not pay a monthly premium for Part A. My guess is that most folks on this call today are not paying a premium for Part A. Your hospital costs is a little different. There's a deductible. So Part A deductible is $1,632 currently for each inpatient hospital benefit period, meaning this is the amount that you're responsible to pay before original Medicare kind of kicks in. There's a really nice detailed list at this link, and we'll make sure to share these links with you after the presentation today. But this link will provide you a lot of information about a very, very detailed situations, and it will explain what that means about hospital benefit period, because it can get a little confusing there. Part B, what does Part B cover? Part B is typically your outpatient care, doctor's services, PT, OT, speech, lab services, diagnostic tests, ambulance, and durable medical equipment. You'll hear people say DME, and they are talking about things like canes and walkers and things like that. There are also many, many preventive services covered, such as annual wellness and many preventive screenings that are covered by Medicare as well. And this is a great website also there that lists all of the preventive services. And I forgot to mention, I realize some of you are joining by phone, so I will try to give a little more detail on what we're sharing on the screen. But this lists some great information there about some of the preventive screenings. And I just want to say for everyone on this today that Medicare and You is a fantastic booklet that is sent to most Medicare beneficiaries. It's available in many, many languages. It's available in Braille, Spanish, Korean, Vietnamese, many other languages, and you can also find it online just by searching Medicare and You, the entire book. I look at it all the time, and I have it above my desk, but you can also find it online as well. Again, remember that Part B, unfortunately, does not cover in-home non-medical care like meal prep and companionship and help around the home. So that is one of the kind of missing things that we haven't caught up yet in providing that much needed service. Your costs for Part B are going to be a monthly premium. Again, for most individuals, it's $174.70 per month currently. Again, it may increase in 2025. Some years we see it stay the same, so let's hope we don't have that amount yet. People with an annual income of more than $97,000 for an individual would pay a slightly higher premium. So it kind of goes up, and you'll hear people talk about this income related Medicare premium adjustment. There is an annual deductible of $240, so you're responsible for that portion. And after that deductible is met, you typically pay 20% of the Medicare approved amount for Medicare approved medical services. So again, Part B is what's used for most outpatient doctor's appointments and services, tests, and things like that. I'm keeping an eye on my time here. Not covered by Part A, of course, Part A or Part B are many things. Again, there are gaps in Medicare, and it was not set up to cover everything, which is unfortunate, but these are some of the things and some of the reasons that someone may be interested in getting a supplement. These are some of the many things that aren't covered. And I'm going to talk a bit about Medicare supplements. It kind of transitions nicely there since we know it doesn't cover everything. So they're called, as Sonia pointed out, they may be called Medigap or Medicare Supplement Insurance. Sometimes MedSup is used. These are health insurance plans sold by private companies to supplement Medicare, and they're used with original Medicare only, so Part A and B. You cannot have a Medicare Advantage plan if you have a Medicare supplement, and you can't have a supplement at the same time that you have a Medicare Advantage plan. So again, these fill in the gaps not covered by Medicare. How they work is you pay an additional premium in addition to the Part B premium and Part D that we'll get to They're different than Medicare Advantage plans. And again, you can't have them at the same time as a Medicare Advantage plan. There's standardized plans available. They have letters, which makes it really confusing and which is a good reason to contact a SHIP counselor. They are letters A through N. And the plans with the same letter, so a plan A offered by Aetna is going to have exactly the same benefits as a plan A offered by USA Insurance. And generally, once someone enrolls in one of these plans, that plan is kept long-term. So this is not one that you're going to be switching every year during open enrollment. Again, you must have original Medicare. It covers the major gaps, and it only covers Medicare-approved charges. These are standardized plans, and the more a plan offers, unfortunately, the more expensive it will be, but the plan benefits, again, are identical from company to company. There's a 6-month open enrollment period, initial enrollment period for Medigap or Medicare supplements that starts the first month that you're 65 and enrolled in Part B. This period gives you a guaranteed right to buy any supplement regardless of your health status. So during this first enrollment period, they cannot turn you down based on your past health history, based on your health history. Medicare standard supplement plans do not have a network. So if you come to a doctor that accepts Medicare, your supplement plan will pick up the remainder. Again, all plans cover the same core benefits, and the state of Illinois has a really nice guide that lists all of this. If you're in another state, they have similar guides that will show you all of this. And I've just shared that link there on the screen. Again, just reiterating, the best time to buy a plan is within 6 months of enrolling in Medicare because that allows you to receive guaranteed issue. And once it's selected, it's held long-term. Enrollment in a plan is completed directly through the private insurance company. Other supplemental coverage is sometimes retiree benefits from someone's former employer or union. Usually Medicare pays first and that plan would pay second. And sometimes an employer or union health plan coverage through current employment of yourself or spouse. So you can delay enrolling in Part B, but this is really when talking with a SHIP counselor is a good idea because you want to make sure that you don't get hit with a late enrollment penalty for enrolling in Part B when you were first, for not enrolling in Part B when you were first eligible. And now Sonia is going to talk a bit about Medicare Advantage plans and what makes them different.
Thank you, Stephanie. Okay, now going back to, for those who can see the screen, we're talking about the puzzle. And now we're talking about the right side, the Medicare Advantage plans, which is another way to get your Medicare benefits. Medicare Advantage plans are sometimes called Part C. If you choose a Medicare Advantage plan, Part C, you are essentially choosing a privatized version of Medicare in which you have your Medicare claims paid by a private company. This is referred to as Medicare Advantage plan. Okay, so for premiums, note that some Medicare Advantage plans are 0 premium. These are free in that there is no monthly premium, but keep in mind that most people still pay for their Part B monthly premium, which is $174.70 in 2024. So basically, you still have to have Parts A and B. You just have all of your benefits offered by a private insurance company. Next slide, please. So how Medicare Advantage plans work. You may have to use doctors, hospitals, and other providers that work with the plan, which is also known as they're under your network, their network. You may get extra benefits like vision, hearing, or dental services. Select and enroll in a plan for the calendar year and reevaluate the plan during the annual open enrollment periods, which are coming up soon, October 15th through December 7th. Next slide, please. All right, monthly premiums may be lower than Medigap plans. There are still co-pays or co-insurance for each service. The Medicare Advantage premium is paid in addition to the monthly Part B premium, as I mentioned before. Medicare Advantage plans are now required to have a maximum out-of-pocket limit for Medicare Parts A and B services. If this limit is met, the plan then covers the cost of the Part A and B services for the remainder of the calendar year. All right, next slide, please. All right, so I do want to reinforce people need to really be aware of the first and last options here, and I'll name them out, to double check and triple check that their doctor accepts a plan before they make a change. Often a plan's representative may say, we already know all of your doctors accept this plan, but please be aware that that is not always the case. And some questions to ask before choosing a Medicare Advantage plan. Can you see your current doctors and use the hospital of your choice and get full benefits? Is the list of specialists extensive in your area? Does the plan cover your prescription drugs? What are the monthly costs, such as premiums, co-pays for services you might need? And when and how can you get out of it if you don't like this plan? And verify claims made by a sales agent before enrolling. For example, call your doctor to be sure they're in the plan's network and accepting new patients. Okay, next slide, please. Okay, so the Medicare Advantage plan's enrollment period. A Medicare Advantage plan enrollment period and disenrollment period is available January 1st through March 31st of every year. If you are enrolled in a Medicare Advantage plan, you will be able to make a one-time change to another Medicare Advantage plan or return to original Medicare, the Part A and B, and enroll in a standalone prescription drug plan. You can also continue to use Medicare annual enrollment period, October 15th to December 7th, to enroll in and switch plans or disenroll from Medicare Advantage plans for the following calendar year. Okay. All right, another thing here from Medicare Advantage open enrollment period from January 1st through March 31st. If you're enrolled in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan or switch to original Medicare and join a separate Medicare drug plan. And once during this time, you can only switch plans during this time, during this period. Next slide, please. Okay, so now we're going to switch gears and discuss Part D. This is your prescription drug coverage, and it is basically required for everyone. If you do not enroll in Part D, sometimes you will see people who say, I don't need Part D, I don't take any prescription medications. Unfortunately, you pretty much do need to enroll in Part D because eventually there may be one or two medications you have to take. And you can get beat with a late enrollment penalty if you do not enroll in Part D. And two types of Part D plans to choose from. If you are enrolled in original Medicare, you can enroll in an insurance plan that covers drugs only, called the prescription drug plan. And if you are enrolled in a Medicare Advantage plan that includes prescription drug coverage, that plan will cover your drugs and other health benefits as well. But what is covered under Part D? The key to picking a good plan is to use your drug list, your medication list. to ensure that your prescriptions are covered well by the plan you pick. And Medicare.gov has a Part D plan finder that is very useful and easy to use. The next slide, please. So Medicare Part D plan costs. Monthly premiums vary by plan. There's an annual deductibles. They also vary. Many have a zero deductible. Co-payments or co-insurance for each drug filled. Late enrollment penalty is 1% extra of the Part D premium you will be paying. It's applied to the Part D premium after enrollment for each month you were eligible but did not enroll. So we encourage to enroll. Exceptions to the penalty, you have a credible drug coverage through an employer, a retiree, or union plan, or a VA coverage. Next slide, please. So here's a cost overview of the Part D. As we have seen, the cost can really add up, but do not fear. There are people and programs that can help you. And this is what Stephanie will talk about next. Thank you.
Hi, so I will just briefly talk about some of the changes that we're seeing that are helping at least a little bit to make things more affordable, because as Sonia pointed out, it can really get overwhelming with the costs. So this is very exciting news that we've just recently learned that there will be lower costs for certain medications that were previously very expensive and are still expensive, but less so. Some of them are listed here. This was from the current administration's social media, and SHIP can help you with understanding what this means for you. But overall, this is very good news. Some ways to check your coverage, and then we'll go back to other ways to make things more affordable. But what we find a lot of times is when people come to us, they may not even know what exactly they have. They're not sure if it's a supplement, a Medicare Advantage plan. They're not sure if they're on any assistance programs. And so these are good places to start to even figure out what you have. 1-800-Medicare, which I'll read just in case you all are not seeing this, 800-633-4227. But if you ever forget, 1-800-Medicare. Social Security Administration is the agency that helps with benefits, with eligibility and enrollment, I should say, and their number is 800-772-1213. I tend to have better luck when I call them in the very first thing in the day, or weirdly at 7 p.m. or so. Medicare and You, again, just highlighting that book there as a great place to look for a lot of this information and virtually everything we're covering today. More ways to look at your costs and including the next year. I can tell you from looking at it today and helping someone with a plan finder that the new information, of course, is not there yet. So we're not in open enrollment, but starting October 15th, you'll be able to see a lot more detail there by using the plan finder tool. You go to Medicare.gov, and at the top right, you're going to see Find Health and Drug Plans. And from there, you can do a generalized search, but it's even better if you can enter your own information from the Medicare card. If you get stuck and you don't know what your password was, maybe you created one 4 years ago, maybe someone helped you set it up, you can always call that 1-800-Medicare number and they will help you with resetting your password. In Illinois, you can also contact a SHIP counselor, of course, and the number statewide, and we'll give this again a couple of times, is 800-252-8966. You do have to specify that you're looking for SHIP counseling because that's the state Department on Aging. So it's a couple of different, buttons, but does not take too long, and let them know you need a SHIP counselor in Illinois. Before it gets too late, I'll mention every state has a SHIP, and they are sometimes called something different. So just be aware if you're calling in from someplace else or joining us from someplace else that you also have these counselors available to you that can provide free and unbiased information. We're not selling anything. So be sure to contact Medicare or a SHIP counselor when you're first eligible for Medicare. Make a plan for enrollment based on your specific situation and looking at the different types of plans, and keep documentation of what you decide to do and why and who you spoke with. This is especially important if you delay enrollment in that Part B, like we were talking about, which some people choose to do. I wanted to touch a little bit on some Medicare benefits that may help, again, with making it more affordable. One that is historically underutilized is a wonderful program, the Medicare Savings Program. You'll also hear them called QMB, SlimB, and QI1, but they're all different. The important thing is they are Medicare savings programs that will help you not have to pay your Part B monthly premium of $174, $175, and possibly more next year per month. So these are really wonderful programs. In Illinois, you can apply online at ABE, so Abe Lincoln, abe.illinois.gov. You can also call your state SHIP to see if you qualify. They're available in all states. They're wonderful programs and they pay that Part B premium. And some of them, if you're a little lower income, will pay additional costs as well. Extra Help is a fantastic program as well. It's only for Part D costs and it's very easy to apply online. You can search for the Extra Help applications, what I do, or go to ssa.gov. You can also apply in person at your Social Security office or by calling Social Security, and I'll read that number again, 800-772-1213, and the program is just called Extra Help. You will sometimes hear it called LIS, but it's Extra Help with Part D costs. Medicaid is income-based and it differs quite a lot. You can still qualify for Medicaid even if you are worried, you've heard what the income amount is and you think you're not sure that you qualify. You can still apply because there is a program by which you can utilize your medical expenses to still qualify for it. So maybe you're $200 over the income limit, but you are receiving gigantic medical bills. You can kind of use those bills to qualify for Medicaid. It gets really very specific, so I don't want to go too much into Medicaid, but briefly, you can have both Medicare and Medicaid. In Illinois, you can apply online at that same website, abe.illinois.gov, and that's kind of your best method because you can track it, you can add, you can upload those bills, different things like that. If for whatever reason that's not accessible to you, you can definitely still do it by calling their number, 800-843-6154, or by going in person to a family community resource center, or by paper application, and we can help you with all of these things. Having Medicare and Medicaid together, I just wanted to say, is a very good option if you're finding it hard or impossible to afford your medical costs. Medicaid kind of acts like a supplement in that case and picks up the cost that Medicare doesn't cover. It provides full benefits for people with no other coverage and fills in the gaps for people with Medicare, as long as you go to doctors that accept Medicare. Again, most doctors do. The application can take a long time, so it's good to get that started. It's faster if you provide supporting documentation right when you're applying. I'm keeping an eye on my time. Some other ways to check and see what you might be eligible for. For example, if you're not sure that you qualify for Medicaid or Extra Help, you can look up that information at benefitscheckup.org. It's a free online tool that connects older adults with benefits they may qualify for. And USA.gov, I learned, it was formerly benefits.gov, but USA.gov includes all federal and state benefit programs for which US citizens may be eligible. You can search by state, category, or agency. and investigate other resources option for more programs. There are also a number of other ways that you can obtain help paying for prescriptions. I won't go through it in detail, but there are coupons you can use, discount drug cards, and patient assistance programs. There's also diagnosis-based assistance programs, and there are many different rules, applications, eligibility requirements that, again, your state health insurance program can provide you with the information on. These are some good sites that I have found helpful. I think that rxassist.org is the easiest that I have found to search on. A lot of people like GoodRx and a lot of people like Needy Meds. They have a helpline, which is 800-503-6897. Some people like Blink Health, some people like Capsule Pharmacy. There's a lot of different ways that you can try to save money. I want to just emphasize that we should all be very aware of ruthless advertising, including mail, online, and phone. I bet a lot of you have stories about receiving information via one of these ways and really being pressured to give your information. And please do not give out your social security number, Medicare, or any personal information to salespeople. Generally, one of these agencies, Medicare or Social Security, is not going to call you to ask for that information. So when in doubt, do not give out that information. We listed some of the reputable sources. They include Medicare.gov, which I know I keep repeating, but the reason I repeat it is that I've also found two sites that are not the government site. So Medicare.com is going to try to sell you something, and Medicare.org is going to try to sell you something. So please only go to Medicare.gov, and you can find the answers to almost everything we're talking about today on that site. These other sites I've also found helpful: MedicareInteractive.org and KFF.org with Medicare fact sheets. I'm going to really quickly talk about some important changes. So Part B coverage, this has started this year already, but the coverage begins earlier for those that enroll a little bit late in Part B. And there are lower cost sharing options overall for Part D. I think probably the one that will have the most benefit for most of us is the cap on total out-of-pocket costs on prescription drugs. There's also a new payment plan Sonia's going to tell us a little bit about that we are still learning about because it hasn't gone into effect yet.
Thank you, Stephanie. Yeah, so this new prescription payment option is new. It's beginning on January 1st of next year. So it requires Part D plan sponsors to provide their enrollees with the option to pay out-of-pocket prescription drug costs in the form of monthly payments over the course of the plan year, instead of all at once to the pharmacy. Now, let me reinforce, this is if you have a prescription drug plan, prescription Part D plan. And program participants will pay $0 to the pharmacy for covered Part D drugs. And then the Part D plan sponsors will then bill program participants monthly for any cost sharing they incur while in the program. So the pharmacies will be paid in full by the Part D sponsors in accordance with the Part D prompt payment requirement. And next slide, please. If you select this option, this payment option, each month you'll continue to pay your plan premium if you have one, and you'll get a bill from your health or drug plan to pay for your prescription drugs, again, instead of paying at the pharmacy. There's no cost to participate in the Medicare prescription payment plan. Now, this option might help you manage your monthly expenses, but I want to reinforce it does not save you money or lower your drug costs. You're still paying for your medication. You can find a video on the Medicare.gov, as we've mentioned before. Medicare.gov, there's a section, you go under health and drug plans. Then under that section, prescription Part D plan, and you go to cost for Medicare drug coverage. And they give a little bit more information. And again, there's a video. Sometimes it's a lot easier to hear or see the video to understand. It is a lot of information. And again, please reach out to your SHIP counselors if you have any kind of questions. And moving it to assistive devices in Medicare, as we get often asked about assistive devices. So just a reminder, Medicare does not cover home modifications such as ramps or whitened doors for improving wheelchair access. It also does not cover assistive devices such as large button telephones or flashing doorbell signals. Durable medical equipment is equipment that helps you complete your daily activities. It includes a variety of items such as walkers, wheelchairs. To be covered by Part D, the DME must be prescribed by your primary care provider. And if you are in a skilled nursing facility or a hospital inpatient, DME is covered by your Part A. Whether you have original Medicare or a Medicare Advantage plan, the types of Medicare covered equipment should be the same. And then passing it down to Stephanie. Thank you.
Thank you. We're almost done. I know we are going into our next portion shortly. I'll keep this really short. People always ask about the donut hole. So this is also known as the coverage gap. So with Medicare for your medications, after you and your plan combined have spent about $5,000 this year, you're in the coverage gap. So at that point, you have to take on up to 25% of the cost of your medications. But I suppose the good thing when your own out-of-pocket spending hits $8,000, you've reached catastrophic coverage. And once you're in that, you no longer have to pay any out-of-pocket costs for covered drugs for the rest of the year. We always get questions about that, and I look it up each year. It has gotten better in terms of the amount that people are responsible for spending, and I hope it will continue to go away. I want to reiterate, when in doubt, please call SHIP. It's a free Medicare counseling program. We are not trying to sell you anything. In Illinois, it's sponsored by the Illinois Department on Aging, but we're throughout the state at many different agencies, like Sonia and I are here at Rush, and each state has one. So you might just have to look that up and search it, or have someone help you looking it up. State health insurance program. It's called different things in different states at times. It's mostly called SHIP, but in Ohio it's called OSHIP, and in Florida it's called SHINE, which I love. So I just want to reiterate the number there, 800-252-8966. If you call us in Illinois, you'll be connected to a SHIP counselor. If you need a different state, they can help you with finding that as well. Thank you all so much for your patience with us today.
Thank you so much, Sonia and Stephanie, for your wonderful presentation. I'd like to invite our next speaker, Janine Cockrell, who will be joining us to talk about PT.
Good afternoon. Oh.
We can hear you, just can't. There you are.
Can you hear me?
Yes, we can.
Good afternoon. I'm Janine Cockrell from physical therapy here at Rush University Medical Center, and I'm going to talk about how you can prevent falls in the home and through exercise. And also, I wanted to say, if you feel like unsteady in standing or walking, or you've had several falls within the past year, you can always ask your physician for a referral to physical therapy. Next slide, please. Next slide. Today, I'm going to discuss what will happen during the physical evaluation by physical therapy, discuss assistive device, just briefly mention exercises because when you go to physical therapy, they will modify exercises directly for you and home modifications. Next slide, please. Next slide. When you go for a physical therapy evaluation, you're going to have strength testing. So they're going to see how strong your arms and legs are. They're also going to do a posture analysis. They're going to see, are you too far forwards? Are you leaning back too much? Also, they're going to assess your sensation and your proprioception in your arms and legs. Sensation will be your light touch. Can you feel someone touching you? Proprioception goes more into, can you feel your feet on the floor? Can you feel something in your hands? I know people have told me that they've lost their proprioception after chemotherapy or sometimes with some neurological problems. Physical therapy will also do a gait analysis and then do a balance screening. They will also assess whether you need an assistive device from walking, prescribe an exercise program, recommend footwear, and then home modifications. Next slide, please. Assistive devices. Next slide. The 3 assistive devices that we really recommend are the cane, a rolling walker, and a rollator. The rollator is like a rolling walker, but it has hand brakes and a seat. And for the rollator, we really recommend that you just have wheels on the front, not a rollator with all 4 wheels on the back. And for a cane, we just want you to use a straight cane. Sometimes with a quad cane or the 4-prong cane, people don't put all 4 legs on the ground, which can produce a fall hazard. Also, the assistive device must not be broken, must not be missing a tip, and for the rollators, the brakes must be working. And as a reminder, Medicare will cover an assistive device every 5 years. So make sure you ask your doctor for a referral to submit to insurance. Next slide, please. Just in case you have an assistive device and you want to make sure it's the proper fit, but you haven't seen physical therapy to get it measured to your correct height, you want to place your hands at your side, and you can do this standing in front of a mirror. You want the top of the grip to line up with the crease in your wrist, as shown in the picture if you have this on your computer. And when you go to adjust your walker, make sure you're sitting down. A lot of times the legs on the walkers are telescoping, so you just have to push the button in and move it up or down. Also, canes should be used on your opposite side of your weak or painful leg. If you ever watched House on TV, he used his cane incorrectly. Next slide, please. Next slide. To maintain your balance and strength, we recommend that you stay active and always check with your physician before doing any exercise program or aerobic exercise. One of the best ways to stay upright and keep your posture intact and your balance intact is standing exercises. That's why we really recommend a walking program for 30 minutes 3 times a week. Also, strength training can be done at any age, and strength can continue to increase. And it's important to keep your legs strong so that you can climb stairs, get up and down from chairs, and get in and out of bed. Next slide, please. As I mentioned before, balance exercises done in standing are the best. Tai Chi has been found to be a very important balance exercise. And in order to do Tai Chi, you can do this at the YMCA, a park district might be offering a class, or even your community center. Another exercise that has been found to improve balance and strength is called the Otega, but this is done from a physical therapist who's had training, and this consists of doing the exercises 3 times a week and doing 17 different balance exercises and strength exercises. And once you start in this program, these are exercises that you continue to do for the rest of your life. Another way, if you found that you've lost sensation or proprioception, is to do single leg squats. And when you're doing this, you're going to have your leg that's unweighted out in front of you. And then if you need a little bit of balance, you're going to hold on to the back of a chair or at a sink so you don't lose your balance. Another exercise you can do is to work on picking up a cone that's in front of you, whether standing or sitting in a chair. Other ways to increase your proprioception would be wearing a weighted vest. You can also do the exercises barefooted, or wearing compression socks will help with the proprioception in the legs. And even there's gloves that people have worn on their hands to help with the proprioception. Next slide, please. Next slide. Next, I'm going to go over some home modifications that you can do to prevent falls in the home. In the home, we want to avoid floor covering that is loose or thick pile carpet. Also, throw rugs or area rugs need to be picked up unless they have a non-slip backing or they got double-edged tape. Repair any tile or vinyl flooring that is torn or uneven. You want to avoid clothing dragging on the floor when you're walking, sitting, standing. Also, in addition to this, I had someone tell me that her mother fell because the tablecloth was too long and was touching the floor, and she tripped on that. Also, wear shoes with a good back. Avoid flip-flops, slides, or scuffs. And then if there's any clutter on the floor, make sure to pick that up so you've got a clear pathway. Next slide, please. On the stairs in your home, you want to keep objects off the stairs. You want to use handrails. So preferably to have 2 handrails on each side of the stairs. One handrail is preferable to no handrails. If you've got any broken stairs, fix them. And also we recommend light and light switch at the top of the stairs and at the bottom of the stairs. And carpet should not be loose or torn. If it's loose or torn, please remove it and you can replace the carpet and put non-slip treads there. Next slide, please. Next, I'm going to go through the different rooms in your house on what the recommendations are. In your bedroom, have a lamp close to the bed so it's easy to use, and always use a nightlight for a pathway to the bathroom. Make sure your furniture in your home is the right height. If your sofa is too low, you can always look for furniture risers to put underneath each leg. You want to avoid sofas or chairs that are deep or puffy. Also avoid chairs without armrest. Next slide, please. In the bathroom, you want to make sure you have grab bars that are the right height. You can have the grab bars in the shower, by the toilet. Also use non-slip mats on the floor and in the shower or bathtub. And in the bathtub and shower, you can also use the self-stick adhesive strips. If you're unable to stand, use a shower chair. In the kitchen, keep items that you commonly use at waist height. Consider hooks on the walls for your pots and pans. And also, never stand on a chair to reach anything that you can't get from the floor. Always make sure everything's down low where you can grab it. Next slide, please. This is just a picture, and we've got a little code there that you can use on your phone to show you recommendations of what you should be doing in each area of your home to prevent falls. And that concludes my presentation. Thank you.
Thank you again, Janine, Sonia, and Stephanie. This has been really informative. Definitely, I know I'm learning a lot about Medicare, as well as always a great reminder about things around the house and how to avoid falls. So also something that you mentioned, Janine, that I want to bring up to those folks following us or watching, if for balance, if you are worried about being a fall risk or want to do classes about balancing, we do offer matter of balance through Rush Generations as well as Tai Chi, and you can do some Tai Chi right now is enrolling and doing virtual Tai Chi, but we also offer all these classes in person. So check out our calendar for upcoming classes in those areas.
Thanks for the reminder. I wasn't aware that you guys offered Tai Chi.
We do. Thank you so much for that. It just reminded me when you talked about it. I was like, oh yeah, we do that. So it's a great reminder and a great way for me to just remind folks out there. So I want to take this moment to open up the floor for those that are joining us here via phone, for our presenters to come back online and open it for questions and answers. If you are listening on the phone and have a question for any of our presenters, please hit *6 to unmute yourself. For those of you who are joining us on YouTube, please enter your questions in the chat and I will pass those to our presenters. Okay, I see a question that was forwarded to me. Is PT covered through Medicare? And this is a question for all. I'm not sure. Take that.
Go ahead, Janine. I think you'll
I
know
was going
better
to say, you know, as you mentioned earlier, I believe it was Part B does cover outpatient and home health physical therapy. But technically, to get home health therapy, you have to be homebound. So mostly our visits would be outpatient, especially for the fall risk and the evaluation and the introduction of the exercise program.
Thank you for that. Anything to add from anyone else?
I would agree. And just as Janine said, it's so important to ask your doctor if you are feeling like you could benefit from that. Go ahead and ask, because a lot of times the difference is whether it's medically prescribed, and if it is, then typically yes, covered through Part B. If you are at home, it depends on if you're, as she said, that you have to be homebound to get it at home. And when you are in the hospital, then yes, if you receive Medicare and it's a qualified, hospital stay, that it would be provided when you are in the hospital.
Thank you for that. Again, I want to remind those folks that are joining us via phone, if you have a specific question that you'd like to ask or add or comment, please hit *6 to unmute yourself, and then we can answer it then. As we're waiting, I know that I had another question that was forwarded to me.
Hello, sir. I am Hamid Sarwar. I have Medicare, but my wife has now completed 65, and she needs the Medicare enrollment. I am a part-time faculty, and I have not any credit, 40 credits, but my wife is also a homemaker. So what should I do now? She has she got her age 65 on June 12, 1959. Her date of birth is June 12, 1959, and she has attained the date of 65 years on June 12, 2024.
So just to clarify, your wife has just turned 65 this June of 2024, and you are currently employed, and they are
no. I am a retired
retired
faculty. I have the Medicare, but my wife, what should I do for my enrollment of my wife for Medicare? She's having
I'll leave it to our experts.
Hi, this is Stephanie. Thank you for the question. I think when it's a specific situation like that, in general, of course, SHIP can help, and I would call that 800 number, 800-252-8966. Yeah, go ahead.
Yes, I want to, I will write the number.
Oh, yes, yes, I'll do it more slowly. Ready?
Yeah, now
Okay.
please.
800
800
252
252
8966.
8966. So for enrollment for my wife, I have to call this number.
So to enroll, it would be Social Security, but the reason I gave you the SHIP number is I think with those specific questions, kind of like, as you're looking to kind of navigate this situation, which can be a little bit confusing with your work history and her, as you said, being a homemaker, and just we can always help kind of address some of those unique, specific situations, if that helps. And
Yes. Yes.
Okay, great. And if you're here at Rush, we also take SHIP referrals within our department. After I'll give you information about that if you'd like to put any information there in the chat.
So where we have to go for in the Rush, because we are the patients of Rush Hospital in different clinics. My wife is also in the Rush clinic. So where to go for consultation about the Medicare in the Rush Hospital?
You know what? The best thing is that same number that I gave you, that 800 number, and let them know you're looking for the SHIP team at Rush. We have a small but mighty team here.
So
yeah, no, thank you for the question. I think anything kind of specific like that, it's always great to start with that 800 number. And they are throughout the state. And if we fill up, because sometimes we do here at Rush and sometimes other sites do too, but there are sites throughout the state, we can do it, by phone, by video, or in person, whatever's easiest for you.
So do you have any information about this, what I have asked? What to do? Is there any information, any tentative thing that you can provide us? Any useful information in my case for my wife?
I would refer you to that number, but also Social Security, because they're the ones that handle eligibility. And I can give you that number if you want to write it down as well.
Please give.
It's 800 772 1213.
So this is Rush?
That number is Social Security, and they're the ones that handle eligibility and enrollment for Medicare.
Oh, okay, madam. Okay.
Thank you so much for that question, and thank you so much for being so thorough with that, providing that information, Stephanie. Specifically, one of the reasons we definitely want to keep to general questions is that we can't go into specifics about anyone's condition, just to protect your privacy. And so I think what Stephanie was definitely very good about letting you know is to definitely call that 800 number that she first provided you, so that you can get connected to a team member that can ask you specific questions to your case. And that goes for anybody listening or watching us. That way they will be able to create a case for you and assign you to a person to be able to help you with your specific needs. Again, for anybody listening, if you have any questions, please hit *6. We have a few more minutes with our experts here that are open to your general inquiries. I think a question came in through chat. I think this will be again for Stephanie or Sonia. You mentioned it in the lecture, but someone's asking, is the SH, I think they meant SHIP, counseling only available in Illinois, or do other states have this program? I remember it, but Please go ahead, because I know you have the correct verbiage.
Yeah, so it's in every state. And it's like Stephanie mentioned, it may have different names, but it's mostly known as SHIP, Senior Health Insurance Program. And again, by calling that SHIP number, you can let them know what state you're looking for assistance, and they'll give you their SHIP phone number.
Thank you so much for that. Another question that came up is, what qualifies as low income for the savings program?
I'm checking that right now. We have our handy dandy chart of benefits. Thank you, age options. For the programs that I mentioned that are Medicare savings programs, so sometimes again you might hear them called QMB, Slim B. Just don't worry, it's a program that pays your Part B premium. So for right now, the most that you could make with one of those programs is around $1,700. So per month, $1,730. If you're on the border, if you're close to that, if you're a little over, if you're, if there's any question, please go ahead and apply. It does not hurt to apply. And I'll put that website in the chat again. It's a relatively quick, it's a little easier than the full Medicaid application.
Thank you. And Janine, a question for you. Can you share, and I think I can answer this for those that are watching this, can you share the graphic that it was about what to hold in each, or what to look out for in each room of your home?
Oh, that was Hannah was doing the slides. If she can bring that one up, that would be the very last slide. There we go.
Terrific.
And then you can use your cell phone and click on the QR code there on the left, on the right-hand side.
And for those listening and not watching, there is a website you can also go to at www.ncoa.org/advisor/sleep/home-home-older-adult/. That's a long website. Again, that's www.ncoa.org/advisor/sleep/home-safety-older-adults/. And somebody had just unmuted themselves. If they want to unmute again, please press *6.
Hello?
Yes, we can hear you.
Thank you so much. I appreciate this presentation. I'm wondering, do you have a place where we could go to get the slides that you had today?
Yes, I'm happy to share those slides with folks. I will find out how we can do that. I know that they will be available if you go to the YouTube channel. This lecture has been presented there, and it is recorded, so it will be available permanently for you to be able to refer to it. So that'll be the quickest way for you, and it'll be up there later today for your availability.
Thank you so much.
Of course, of course. Okay, it looks like that is our questions have slowed down. If anybody else listening or from chat has a question, please if you're on YouTube, please send your question via chat, and we will get it to our wonderful panelists, and they will answer it for you right now. Or if you're on a call, please hit *6 and unmute yourself in order to talk. We'll wait a few more seconds before we wrap up for today. Here's a question that was sent to us from our viewers on YouTube. What are the self-adhesive grab bars Janine mentioned?
Oh, the grab bars aren't self-adhesive. I must have misspoken. It's the self-adhesive strips that you can put in the bathtub, and you can buy those at any hardware store. Just
Okay.
look in the bathroom section.
Terrific. And I have a caller who has unmuted themselves. Go ahead, please.
Yeah, about grab bars, I just wanted to say some are out there that claim to be like have a vacuum seal with the wall or with tile. That is not secure. Please do not use those.
Good point.
I don't
Yes,
know.
they should be
Folks are familiar. They
in
have
the
to be
wall.
installed.
Yeah.
Go ahead, Janine. Yes, thank you for unmuting yourself and giving us that testimonial. We agree. We definitely would urge you to have your grab bars secured to the wall by a professional if you cannot do so yourself.
Correct.
How can you get coverage for home modifications? Does that go through a prescription, or are there programs that cover this? That was another question that came in from our YouTube.
At this time, I know Medicare does not cover home modifications. There was a program here in Chicago for the aging that people were able to get home modifications done, but I think there was a income level.
That they
So,
had to be. Okay.
yeah.
Do you know what that program was called by any chance?
No, I don't. I can't think of it off the top of my head. I don't know if Sonia or Stephanie is aware of the program.
Just trying to look it up, and I'm going to post something into the chat that is a newer program that it has not, I don't know how, I'll just say I don't have a lot of information on it right now, but I'm going to post it into the chat. And for those that are joining by phone, possibly we can share some of these links later.
My colleague has also said the older adult home modification program is what it used to be called, but it is not up and running any longer. That was the one that was from Illinois.
Okay.
And Stephanie, thank you for sharing that link. Again, for those that are joining us via phone, the links will also be available in our chat on YouTube, but it is incil.org/INCIL announces incil.org/INCIL-home-modifications-program/. But these links will also be available on our YouTube. And if you have any questions, you can always call us at Rush Generations, and we'll be able to share these resources with you. So now that we are at time, I just want to take this opportunity for, here's another link, which just makes it a little easier. It's incil.org/home mod, HOMMOD for home mod. I just want to take this opportunity to say thank you to Stephanie, Sonia, and Janine for joining us today. We appreciate it so much. And I want to, for those listening, I just have a couple reminders of upcoming events that we have. But again, thank you so much to all three of you for spending this valuable this afternoon with us with so much valuable information for our viewers.
Thank you.
So, current and upcoming Rush program. Rush Generations programs. The first one I want to talk about is Walk with Ease. It's a guided walking program. Each week, the walking group meets for 30 minutes to an hour to check in and learn information on how to incorporate healthy habits before embarking on self-paced walk from 10 to 45 minutes. Our next session will be held on Wednesdays, Thursdays, and Fridays at the Garfield Park Conservatory starting October 2nd through November 8th from 1 p.m. to 2:30 p.m. Our next workshop will be Learning to Live Well with Chronic Pain, a 6-week workshop for people living with chronic pain. Participants engage in discussions and skill-building activities to better cope with the day-to-day management of chronic pain. All sessions incorporate an exercise element and strategies for medication management, pacing activity, and rest, etc. Our next workshop will be held in person on Thursdays starting October 3rd through November 14th from 2:30 to 5 p.m. at Rush. To register, you can also, registration is required and it will be at our Rush campus. You can call our 800 number at 800-757-0202. Our next workshop will be WRAP, which stands for Wellness Recovery Action Plan, and is a free program for anyone to learn skills to get well and stay well, and to make life more enjoyable. This workshop will teach participants to develop a daily wellness plan, discover simple and safe strategies, and create plans for responding to stress, negative thoughts, and challenging times. The group meets once per week for 6 weeks for 1.5 hours. This workshop will be held in person on Wednesdays starting October 16th through December 11th from 10 a.m. to 12 p.m. at our Rush campus. Registration is also required for this workshop, so please call our 800 number at 800-757-0202. And lastly, I'd like to remind you of our Shaman Senior Voices. Shaman Senior Voices aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters the most to you with your physician and loved ones. Shaman Senior Voices wants to hear from you, so please consider sharing your wisdom on why it is important for you for your healthcare team and loved ones to know your goals and wishes and what matters most to you. At aging.rush.edu/shaman/collaborate-and-connect, or scan the QR code to record on or on a mobile device or smartphone. Our next lecture will be Cancer and Aging, October 9th, 2024, again at 1 p.m. We hope to see you there. And again, if you have any questions, please feel free to reach out to us at Rush Generations at 1-800-757-0202. And again, I'd like to personally thank you all for joining us again one more time. And we look forward to seeing you in our next lecture.